President Biden signs historic $12 billion executive order for women's health. In March earlier this year during Women's History Month, President Biden signed a historic $12 billion executive order for funding to help us better understand women's health and potentially explore more treatment options for conditions that disproportionately affect women. This executive order, or EO for short, is the most comprehensive of its kind for women. It builds upon the creation of the White House Initiative on Women's Health Research that was created back in November 2023. It was spearheaded by First Lady Dr. Jill Biden and the White House Gender Policy Council. This $12 billion EO will specifically take measures to increase research on women's health and will also assess and address underfunding for women's health research. First Lady Dr. Biden stated that several federal agencies will integrate research on various topics that women generally experience throughout their life, including autoimmune diseases, maternal health, mental health, and menopause. Unfortunately, women's health has always taken a back seat. Only recently have researchers started including women in their research studies. First Lady Dr. Biden highlighted this in a statement she made on the day of the signing of this executive order. She said, quote, "In the early 1970s, researchers in the United States studied estrogen's effect in preventing heart attacks. It was observed that women who had gone through menopause, and therefore who had lower levels of estrogen, were likely to have heart attacks. So, a study was conducted asking whether estrogen prevents heart attacks." She further explained that all the 8,341 patients selected for that study, quote, "were men. This is how things were done, even though women are half the population. Women's health research has been underfunded and understudied. Too many of our medications, treatments, and medical school textbooks are based on men and their bodies. But that ends today." End quote. The director of the White House Gender Policy Council, Jennifer Klein, in an interview with the 19th, and reported by GovernmentExecutive.com, stated that the Biden administration intends to narrow the research gap for women's health, thus hoping to improve their experiences in the healthcare system. Klein further stated, quote, "The First Lady has really taken a leadership role here because she herself and so many people that she's talked to along the way have been told that we literally don't know enough to make sure you're getting the care you need. I hope people will see today as the answer we've all been waiting for to really prevent, diagnose, and treat health conditions in women." End quote. Health issues like anxiety disorders, chronic fatigue, endometriosis, headaches, migraines, and Alzheimer's disproportionately affect women more than men, and research into studying these issues have been significantly underinvested and underfunded by the federal government when compared to ailments that disproportionately affect men. Not addressing and putting more research into these health issues can have negative consequential societal and financial effects for women and the general population. For example, Lisa Jarvis from Bloomberg.com referenced a recent report regarding women's health. Quote, "A recent report from McKinsey & Company found that reducing the time women spend in poor health by 25% could be worth $1 trillion, in large part because health disparities disproportionately hit women during their working years." End quote. There will be 4 major parts of the EO, and they include making women's health research a priority, creating new research methods, reinforcing standards for data collection and research, and imparting new research on experiences women in midlife tend to deal with, such as menopause, and conditions that may occur after menopause, including heart disease, high blood pressure, heart attack, Alzheimer's disease, and osteoporosis. The EO also wants research to address health issues such as breast cancer, lupus, and rheumatoid arthritis, and environmental factors that affect women. And the EO will also include the National Institute of Health's, or NIH for short, involvement to improve testing that would enable researchers to diagnose, prevent, or treat conditions that specifically affect women, like endometriosis, for example. President Biden's EO will also work with the NIH to create its Pathways to Prevention program series. It will focus on identifying research gaps and look at health issues that are underfunded. For example, they will have workshops on menopausal health. The midlife period for women is where research is considered the most crucial because of the many physiological changes that start occurring. Experts state the midlife period, which is between 40 and 60, is one of the most important periods to study women's health, and unfortunately, it's also one of the most neglected and underfunded. The EO, along with the NIH, will also direct the Substance Abuse and Mental Health Service to support mental health issues and discuss the needs of women who have a high chance of substance use. The NIH will also spearhead a new Women's Health Behavioral Health Technical Assistance Center. President Biden's EO will support the United States Department of Agriculture focus on new research that looks at the nutritional needs of pregnant and breastfeeding women and maternal health and mortality. Roe v. Wade was overturned in the conservative majority Supreme Court in 2022. Donald Trump took credit for overturning the federal government protection of one of the key fundamentals of women's reproductive rights, their right to choose. Klein stated that the Biden-Harris administration has put reproductive health care at the forefront. However, it should be noted that because now a woman's reproductive rights have been left up to the individual state, the federal government can only do but so much, especially in states where reproductive rights are now limited due to the overturning Roe v. Wade. It's also worth mentioning that Donald Trump's record on women's rights is subpar to say the least. Dr. Vivian Ota Wong, from the Office of Research on Women's Health at the National Institute of Health, in a statement said, quote, "We at ORWH are thrilled to receive presidential recognition and support for women's health research. This executive order validates the essentialness of women's health research and ensures that we continue to make strides in extraordinary and innovative scientific discoveries, advances, and contributions to the women's health research landscape." End quote. This concludes our video. If you have managed to watch it until the end, we thank you. If this video has been helpful to you, liking and sharing this video and subscribing to our channel would mean a lot to us. What that does for us is it gives us an indication that we are building an audience and that we are creating helpful content for our viewers.